so hot flashes. So the reason hot flashes is a side effect specifically of chemotherapies during breast cancer is that many of the treatments that we're using are to reduce estrogen. So, and we think about hot flashes as a side effect or something that one experiences during menopause. This is one of the similar reasons why a woman will potentially experience hot flashes. And so, but with that being said, because, and I'll talk a little bit about this a little bit further into the presentation, because breast cancer is such a estrogen specific cancer, certain things that we might often prescribe for hot flashes don't necessarily apply in this case. And so, and I'm going to also be talking about two specific, well, we can go to the first two on this list. They can be very effective for hot flashes, so black cohosh and St. John's wort, but they really need to be taken after the completion of chemotherapy, specifically because St. John's wort in particular. So the reason St. John's wort can help with hot flashes, and this is also in I guess you'd say like non-tamoxifen or Arimidex induced menopause, even in menopausal patients, is its effect on serotonin and how serotonin has a role in temperature regulation. But one of the issues with St. John's wort, it does affect one of our cytochromes that basically can either increase or decrease the excretion of certain medications. And again, it's very important with chemotherapy that we don't have it increase more than it needs to, and we definitely don't want to decrease its effectiveness when a patient is undergoing chemotherapy. Similarly, black cohosh should not be used with tamoxifen or also doxorubicin, which unfortunately could potentially increase the toxicity. So these could be used, but they just have to be used after the completion of chemotherapy. Now, the interesting thing also with black cohosh, it has like this strange estrogenic activity where if estrogen is low, it helps to increase, and versus if it's high, it has like the opposite effect. Now, the other two, vitamin E and magnesium citrate plus another hesperidin, can also be really useful during hot flashes and could be appropriate to use earlier on. But the first two, you definitely want to wait until after chemotherapy. Okay, so neuropathy. So this is another very common side effect, and the big problem is that many chemotherapy agents are toxic to neurons. And so how does this manifest? But pain, tingling sensations, increased or lost sensitivity, and it can persist past treatment. And this again is an example of one that starting some of the recommendations before chemotherapy could actually improve the ability of them working. And it's always sort of interesting when you look at some of these studies of when the supplement was actually brought on or when the treatment was actually started, and how much that could have actually had a negative impact in what we would have wanted to see in this study. So the first one, I think I have like a whole, okay, so here we see glutamine again, and as we remember that glutamine can really help with preventing mouth sores, but also similarly, it can help with neuropathy, and again, starting that as soon as possible. Vitamin E, which is a relatively strong antioxidant, has shown really positive effects when it comes to prevention of neuropathy, specifically when it's used in conjunction with the next nutrient, which is NAC, N-acetylcysteine, and these two together have shown to actually block neuron apoptosis, which is basically the destruction of neurons that sometimes can happen from certain chemotherapy agents, specifically cisplatin, and then some other nutrients that are worth noting, omega-3 fatty acids. So these again are from mostly from fish oil, and as we mentioned previously, looking at memory and depression, the DHA component is what can be very beneficial, and there actually are some fish oil products out there that have a higher concentration of DHA in comparison with EPA. So I would typically recommend that over another fish oil. Magnesium, and then lastly B6 and B12. Now, things also to note that there's other little, it's not so much mentioned here, but in addition to destruction of neurons, because some chemotherapies also can have an impact on mineral and nutrient absorption, and that's basically why things like magnesium and B12 could be beneficial in that case. Okay, so heart damage. So this is mostly associated with the anthracyclines, which one example is doxorubicin. And the unfortunate thing is that, so in some cases, patients will experience heart damage right away within a few months of treatment, but then there also seems to be a certain patient population that might experience some heart damage many years after completion of chemotherapy. And so some of the big things that we would recommend, and these are actually very similar to what I might even recommend to somebody who does have a history of heart disease. So acetyl-L-carnitine, again, thinking back to its ability to help with the transport of fatty acids, very helpful for the for heart muscle. And then CoQ10, which is a really strong one. It's an antioxidant, but again, also helping with the energy around the heart muscles. And both of these have shown not to have any effect on these chemotherapies. So these are things that you could essentially start before and during. So high cholesterol. And so high cholesterol, in this case, it's kind of similar if we think back to hot flashes. So this is very much a factor of the change in hormones. And so many of the things that we would recommend would be similar things that I would recommend to any patient who is experiencing high cholesterol. So fish oils, so high omega-3 fatty acids, high fiber, specifically soluble fiber, can help reduce cholesterol. And then the last two antioxidants, one is vitamin E and vitamin C. Now with vitamin C, there have been more and more studies showing that it can negatively, unfortunately, affect cancer treatment in the sense of it because of its antioxidant properties. So not to say you can't have vitamin C, but that would be something that you would want to wait until after chemotherapy.